to prevent any confusion, um, just raise your hand. I have my computer screen here, and we can answer the questions. Okay. So 1 second. Let me organize myself. All right. First question I have for you guys today is, just raise your hand. Um, what medication would you give a patient with acute dystonia? Oh, one of the possible answers. Anyone?
Urgentin?
Ogentin. All right, very good. Kava Kava is a medication that. Oh, okay. You can answer the next one. Go ahead. Like, what your name is now? It's Griven. Okay. So what are your question? If you have one, no. Okay. Uh, what Kava Kava is contraindicated with what medication?
Benzo?
Benzo. Very good. All right. So actually, do raise your hand because otherwise, many people will be.
Oh,
Uh,
I'm sorry.
it's fine. It's totally fine. We're here to learn together. So now, since we're talking about Kava, what body system is what condition can Kava cause? If in toxicity level, we're referring to what body organ? Go ahead, blessing
The
child.
liver? The liver?
Liver.
Yes, liver. Okay, very good. So the points that I wanted to make is if someone going to surgery, they should stop kava. Someone is taking benzo, should not be taking with kava, and can cause hepatotoxicity, right? Liver conditions there. Now, if I say things like a man lost his wife and now he's talking to you and says, "Wow, she was the best woman ever, and most beautiful, most intelligent, most hardworking person I ever met in my life." What defense mechanism is he using? Anyone want to raise your hand for this one? What kind of defense mechanism is he using? I had the best wife ever. She was the most beautiful woman. She was the most hardworking person in the world. I been so blessed to be married to her and so forth. Is he's using a defense mechanism? What is that called?
What is it called?
Coping? Coping mechanism?
Mm.
Yeah, it's a coping mechanism, but it's a defense mechanism
Could
called,
we,
like we have a defense mechanism that we all use, but which one is he using?
could you give examples?
Uh, is it idealization? Is it sublimation? Is it
Rationalization.
rationalization? But which one is it? Is idealizing her,
Realization.
right? So when you make it, oh, the person's the best thing ever, so forth, that's idealization, right? So, okay. So let's say a patient is on Risperdal. How would you assess someone is on Risperdal? What would be the first metabolic syndrome symptoms that you would see? Raise your hand. Anyone?
Gynecomastia.
Well, yeah, that's a good one, but it would not be the first.
Weight gain.
Very close. Hip to
Lipid.
waist,
Hip
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 to
to waist
waist
to.
circumference. Okay. All right. What is the relationship of what's the relationship of lithium and NSAID. What will happen to lithium when the patient is taking NSAID? Anyone lift your hand?
It will
Okay, Gina, please.
Um, inside is an inducer, so if I'm not mistaken, is gonna uh reduce the level.
Okay, all right.
And
So think this way: any medication that affects where is lithium processed out of the body, right? It's through the kidney.
be.
So
the
any ACE inhibitors, any medication, in this case, NSAIDs, specifically NSAIDs will double of the lithium level. So it could cause toxicity. In this case, right, lithium would be increased,
Decrease.
increased, right? So because it's NSAID, it could cause a decreased lithium. So your actions should decrease lithium dose. Was I clear or not?
Um,
Okay. So NSAIDs will double lithium dose. So if the question asks you what will be your action, it will be to decrease the lithium, right? Because of the lithium toxicity. So anything like a indomycin or Mobic or meloxicam, right? So it could increase the lithium level. When we talked about MMSE, you need to know, I've been talking about this many times, you need to know well the difference between thought process versus thought content. Can anyone differentiate with details these two conditions or these two process and content, thought process and content? What are the main difference? And give me an example. All right. Anyone, please raise your hand and go ahead and fire up the answer. It's okay to be wrong. Oh, I
okay, for
do.
okay, I raise
thought
mine.
process, can
Okay.
I? Okay, for thought process is what the patient says. I would say maybe the subjective data of the patient,
Okay.
what the
So
patient say, and then the thought content now is more to do with what they. I'm not sure, but I would say like the content in terms of hallucination,
okay. That's
the meat of the matter.
okay.
Uh,
You have to be very very sure because the questions will be tricky on those two possible scenarios. So I like where you're going. Let me hear somebody else. Anyone else that raised your hand previously?
yeah.
Yes. 6. Oh,
In
Go
thought
ahead.
process, in
Thought
thought
process.
process, we assess for thoughts and ideas, not for the speech. Like,
Okay. Give me an
and
example. Give me an example. I like where you're doing. What are you saying? Give me an example.
example, example if like they are logical or coherent,
Perfect.
or if they are
Okay.
goal oriented,
Perfect.
like
So,
tangential or circumstantial,
okay, you answered the question that I was going to ask. Perfect. Now,
and
thought content.
thought content, it is what they perceive,
Okay.
the disturbance. Example, suicidal ideation, hallucination, visual and auditory hallucination. I think
Perfect.
so. I'm not sure.
No, you nailed it. Okay. So just to let me rephrase this, what you said is thought process refers to a person's thinks, right? Is it is it logical? Is it organized? Is it flow of idea? It's about the structure of the thinking, not the actual content. When they say thought content is what the person is thinking about. The person is thinking about hallucination. The person is thinking about preoccupation. It's thinking about substance use or something. It is the substance of the thinking. Okay. Hopefully
Mhm.
that makes the things clear because I see tons of people getting questions that are easy, incorrect.
mhm.
Okay. So very
Ca-
nice there.
Can I say that when a patient is reporting pain, pain is considered to be subjective. We can
Hmm.
only go by what the patient says.
Hmm.
So, is it safe to say that thought content is whatever the patient states, whatever the patient says. That's thought content because it cannot be visibly seen.
Okay. I
Would that be
mean,
okay to
yes,
say?
I like. Okay, let's ask you a different question. Anybody
Mhm.
agree or disagree with that? It's
I
a it's
disagree.
an odd question, right? Because it's like not something that I've seen before or how people usually say it. But if it
Mhm.
works for you, it works well
Mhm.
for you. So
Thank you.
it's yes. So yes, I
Mhm.
agree, right? Is the
Mhm.
content of what the person thinking about it. So in that case, it's is includes the idea, the beliefs, the preoccupation, or in this case, the pain, right? If it's thought
Okay.
process with the P
Mhm.
is logical, organized flow of ideas, the
Mhm.
structure of the thinking, not the actual content. Okay.
Mhm.
So
Mhm.
that's why I say use the brainscape. I give you flashcards, but it's better when you get the flashcards and you make your own flashcards out of the idea that's in the flashcards because you can make it your own and that's much more personal. Okay. All
Okay.
right. So the next question I want to ask, if we are doing a series of sevens, what, where does it, what is it called? Please raise your hand and speak.
Concentration.
Concentration and attention.
Calculation.
Yeah. Concentration, attention, and calculation, it all falls into the same. Okay. So, ooh, a trick question. In fact, but Michael just answered the question pretty easy yesterday. So let's see. Ragon is not a antipsychotic, but which EPS symptoms I would be concerned with when they refer to Ragon? Ragon.
Say yes.
Say it again.
What is that?
TD.
TD. Okay, very good. Guys, these are important questions. I would write that down. Okay. Don't worry, they'll be in the course and you can review there if you don't want to write it down. All right. Let's say that the patient, ooh, let's say, how do you assess a thought disorder? For example, well, how can I ask this question without giving the answer? Okay. How, yeah, I think that's the best way. How would you assess a thought disorder? What part? Yeah, how would you assess that? What techniques would you use, or which ways would you assess to see the thought of the person or the interpretations of the thoughts?
Hmm. Can you rephrase? I don't understand.
Yeah, it's a hard question. I don't even know how to ask this question. The actually answer is per verb, right? If you say, "Tell me what does it mean to you? Do not throw rocks when you live in a stone, in a glass house," for example. So you assessing
Abstract.
the
Something.
abstract thinking.
Abstract.
Okay, abstract. Thank you. So out of the children conditions, which one comes to mind when someone does not follow orders, has problems with leadership? Go ahead, please. Answer. You
ODD.
raised ODD. Perfect. Very good. Okay. Next question is, I'm trying to come up with some questions here. Um, a patient that's alcoholic, he has he's withdrawing from alcohol with the hepatic problem. Which medication would you give? Go ahead,
Yeah.
Aravindia.
Lorazepam.
Lorazepam.
What was
Okay,
it?
perfect. Right. IM would be good, or even lorazepam. Okay. What score would you give? What score on the SIWA scale would you start to give a benzodiazepine? You raise your hand. It starts with what number? Okay.
15.
Uh,
15.
So, no, it's
okay. Anyone has a
Seven.
different answer?
7.
Okay. I've better out of
eight. Eight.
eight.
Eight.
Eight. Okay.
Okay.
Eight. But seven is it's close enough.
Mhm.
I mean, if we say eight in my group in my study, if you see seven, it would not, and you see the other answers. Obviously, you probably pick seven. Usually by the standards eight, but again, standard is really a bad word. This is more a clinical practice, right? So eight, seven would not be incorrect. Some practitioner may give it seven, right? But eight would be probably the most correct answer.
Could you
Let's
repeat the
say
question, please?
yes. I
Also,
said someone is SIWA. Please do not confuse SIWA with cow scale. I see that a lot. SIWA for alcohol. What score would you start giving benzodiazepine, right? So on the scores of 8+, you start giving. So now I remember something else. So you need to know generally what category of the SIWA scales, right? It's at least the median level because they might give you a scenario and ask what score is the patient like. I do not want you to waste brain power by know every single thing on the CW scale. I just want you to look at it, recognize what's the median, what kind of categories, and make a judgment call at that time. Okay, so can be hard. I know that. Okay,
so we
but
give
compared to wasting the whole day trying to memorize the scale when you could get 20 other points by focus on other high yield content. Okay. So
so
let's say, go ahead, please.
we give the PRN, not the schedule one. All right.
Yes. So start giving the PRN, right?
Mhm.
Okay. So let's say that a child is on amphetamine and develops tics. Which medication will you be switching to? Adderall, Ritalin, methylphenidate, or guanfacine?
Metafenadine.
Officing.
Did I hear methylphenidate?
Yes,
Okay, can you help me, can you tell me a little bit more about your answer?
I just chose it.
Okay, no problem. So let's go back to this a little bit, okay? A question like this oftentimes will be tricky because it comes to you and say that someone with ADHD, I don't know, I'm making things up here, guys. So someone that 11 years old with the return to your office and you first prescribe him and uh, amphetam- amphetamines. And the mother says, wow, what a difference it has made his life. He's thriving in school. He now listens. He completes all his works on time. And trust me, Doc, this has been a blessing in his life. But I just want to tell you about the tick. Now he started having this tick movement, but he says it bothers him some, but he can deal with it. Which of the following medications or which of the following action would be most appropriate? Increase amphetamines, switch to a methylphenidate, switch to Ritalin, leave the medication the same, or whatever, or guanfacine, right? So the answer would be guanfacine because even though the mother reports the child or the adolescent, 11 years old, is doing super good, you should stop stimulants on the first sign of a tick. Okay. So the question comes very tricky because, hey, all indicates that you should leave the medication the same or switch to another stimulant if you're confused. But the core of the question is that you should stop stimulants on your first signs of ticks. Okay. So don't fall for that.
Mm.
Let's say when it comes, if a young lady who agrees for treatment. However, she is concerned about her weight. Without wanting to wanting to be on a medication that's causing. She does not want to be on a medication that causes weight gain. Which of the medications would you prescribe? I'm going to give you an options here. Raise your hand. A, let's say trilepto. B, let's say lithium. C, lamictal. Or D, Zyprexa. Which of the following medications would you pick? Oh, you guys raise your hand already. So let's go with Uma. Yeah, I don't know who was the first. Sorry. Uma, you got an answer there? I don't know if you raised your hand or it was a mistake. Uma, are you there? If you are, you have to unmute yourself. Okay. I don't know if you are.
Lamictal.
Lamictal. Okay. So what other medications are known to be for you too, woman, since you answer this question is related, what other medications are known to be less less propitious to weight gain? Give me at least three or four.
It is
Zal.
Zal.
Okay. All right, that's fine. That's fair. That's fair. Okay. Out of those, okay, so let's keep going on this topic. Which two antipsychotics should you give food with?
Latuda.
Latuda and anyone else help her out? Call a friend. Geodon, right? Geodon. Okay, give it with food. Now, let's say that you have a couple who has conflict and they would like to start therapy. And there's not couples therapy. Okay, I'm going to give you this. Which therapy would be most appropriate for this couple?
Interpersonal.
Perfect. Interpersonal. Okay. Um, let's say you have a 60 years old male diagnosed with schizophrenia, okay, 3 years ago. And he had a score of 27 on on his MMSE, right? So, well, let's stop here. MMSE and slum scale. How are they alike and how
Yeah,
are
the
The
higher
higher the
number
number, the better.
Severe.
are normal for
When
them.
the numbers are increased, that is normal. For example, 0 to 9 is the severe, 27 to 30 is the normal.
okay? I like that. So now you had this 80 years old or 60 years old male, whatever. 3 years ago, the patient came in and had a score of 27. Now he comes to you and his score is 26. What would likely be his diagnosis? Severe dementia? Call the
Mild.
doctor. Yeah, okay, mild or borderline normal, right? So,
Normal.
yeah, okay. I mean, we're talking about potatos and potatoes here, okay? It's not going to be in your question normal or mild. It it will be likely something like normal and moderate, severe, or whatever. Okay, because it's just a scale. You cannot judge specific, be very specific on a scale because the scale is telling you you always have to use a clinical judgment, unless if they say according to this scale specifically, then there would be something different, but they wouldn't do something like that. All right, let's uh say let's come up with some ideas here. Um, okay, let's say if someone is taking a PG1 medications for sexual dysfunction, what kind of education would you give this person? PG1. I don't want to give you like a Viagra. Let's say Viagra.
G1 for
How is the medication works? So it's fastly absorbed. That will be the kind of education that you want to give, like Sindofil, Viagra, right? So go ahead, please. Well, let me refer this. Like a PG1 is injected while Viagra is swallowed, right? So mechanism of action, the PG1 works through the pathway to achieve erection, and PG1 is absorbed direct into the penile tissues, bypassing the digestive system. Viagra is absorbed through the gastrointestinal tract. So I got that a bit confused there, but the principle here is a PGE1 is injectable and is fast. Got it? Any questions here? I can help clarify my when I misspoke. Okay. All right. So let's think about something else that I often see. What else can we ask? Okay. So this is a bit, let me create a scenario for you. Okay. Patient comes in for a scheduled appointment and verbalizes to you that he or she feels terrible and he thinks that the group home where he lives is trying to poison his food and that he is thinking about setting the house on fire while everyone is asleep at night. How would you respond? Let's say challenge the thought. A, call the group home and notify the law enforcement about his homicidal thoughts. C, provide reality orientation and reassure that he is safe. Or D, call the authorities. How would you uh, answer that? Go ahead.
Notify the group.
Okay.
The
All right.
authorities.
Okay. Do you agree with that, Sherry? Sherry, if you do agree or disagree, you have to unmute. Okay, unmute yourself.
so which did she pick?
Uh, she said, call the group. home.
Notify the group.
Yes, notify the group.
And authority.
So
Would you agree?
I would call the post. I would notify the group home too.
Okay. Okay. All right. That's a good answer. I like how you guys are thinking. So that would be the most correct. Why did I say this is complicated? Because
I,
we,
I
we
would
cheat.
call the authorities.
Yeah, it's probably. Sorry. Let me. Oh. All right. So probably um that's why it's complicated. Maybe the authority shouldn't be in the answer, one of the answers, because that's part of calling the group home and calling the authorities, right? So I'm kind of making up stuff here. So why is this question complicated? Because we always teach when should you call the police or when you should call the state board of nursing, right? So this has to do with Tarasov principle, which is the duty to warn. Tarasov principle does not apply to every state, so therefore it's not always obvious that you should call the person imminent dangers, right? So that's why in this case is a little bit more broad. You wouldn't call every person. So calling the nursing home would be the most appropriate. Probably just saying call the authorities. It's not specific whose authorities it's referring to. Probably wouldn't be one of answer choice. But I
Call
see
the
what.
police.
Yes, call the police. But that is included into the option B, the law enforcement.
I have a question, Dr. Lopez.
Yes.
In the case of like where a child would tell the caregiver that he wants to kill his dad, the choices would be you tell the dad or you call the police, because sometimes it can be a little bit complicated.
It
Not
can.
sure
It can.
when
Okay.
to call who.
Yes, absolutely. It can be complicated. I don't think there is a sure answer. One quick second, please. You really have to assess the age and the threat, right?
Mhm.
So I would need more specific in order to give you a more precise answer. So it really is this a 7 years old? Is this a 15 years old? Right? 15 years old has a
They put
much
it
more.
as a 17.
Oh,
17 more
17 years
mature.
old,
Yeah.
that's very close to an adult. This is a real threat. He can do some harm, right?
Yeah.
Oh,
Especially like someone, let's say, let's switch the scenario to most likely question on the test. Someone that is manic episode and he's manic and he wants, and while you assess him, he's saying, I will kill my dad once I go home. And his dad is 70 years old, right? At that moment, you need to stop the patient with their, he's immediate danger to himself. So at that point, it could be possible for admission. You could take several actions as in notifying the police or so forth. It's really those types of questions you have to read and ask yourself, hey, in this case, is that an immediate threat? If it's yes, calling the police is always a safe answer. Is always a safe answer, right? Now,
Mhm.
if the question goes in any way close to the nurse checked the regulations for his or her state. So that is implying that Tarasoff principle could be the answer. Okay. If it doesn't say that you check the your state regulation, right? Calling the police and calling the nursing board to check the regulation is possible the answer. Right? So it really depends. We cannot give a sure answer for something that I don't know.
Okay.
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 But keep that rationale. Those thoughts are very good. Keep them rolling. Okay.
Okay.
Okay. Let's say a patient comes to you and you have done all the assessment, diagnosis, and discuss the treatment plan that includes medication. You decided to start the patient on a certain medication. You fax the medication to the pharmacy. What patient's right have you violated?
Confidentiality.
Confidentiality.
You need sign the consent.
Yeah, you didn't sign any consent.
Okay. So now we are getting to a crash of ideas here, right? There could be confidentiality, it could be informed consent, right? So if the question didn't say anything that the informed consent was signed, right? Then it could be that the violation is the informed consent. So pay attention. If it says the consent was signed, then it wouldn't be a confidentiality issue. Okay, so be careful between confidentiality versus informed consent.
They can put both.
They can put both. Absolutely. Absolutely. Okay. So pay attention to the question. If it just says, hey, I done my assessment, diagnosed, treatment, blah, 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 and I faxed to the pharmacy or whatever, and there was no mention of the consent, right? That's just most likely informed consent, right? Now, if it says things along the lines of speaking to somebody else or giving information to another provider that's not part of the treatment and so forth, that's a break of confidentiality. It could definitely be both. Those are close, very close related. You have to pay attention. All right, raise your hand because this one is a bit easier. Well, let's instead of asking you a question, who could describe to me the dopamine pathway 1 through 4? All the four part. There are more than four pathways, but let's talk the four main pathways. I want to know what happens, and I want to know the symptoms. I think, if I'm not mistaken, I do apologize. I think Sherry, it was the first one that I saw. Would you mind? And then next question will be for you, Gina, and then we go seashell.
Seashell.
Okay. Sherry, would you mind? Give me the four pathways and give me the what happens and give me the symptoms for all four. Unmute yourself.
So VTA, so that you would have the negative symptoms. Then
Oh, so I apologize. You said what symptom? I mean, what pathway? If it's first.
it's VTA. So then
It's okay.
and that's the negative symptoms.
All right. So
And then you
let me start with the pathway, and you tell me what happens there in this symptom. Mesolimbic.
okay.
What do we have on
Mesolimbic
mesolimbic?
pathway.
Go ahead. What do we?
Mesolimbic means positive dopamine, hallucination.
Okay. So I do appreciate it, but
Meso-
let her finish this one, and then we'll go on to the next question.
Yeah.
So give me a second. So Sherry, um, mesolimbic. What is the neurotransmitter involved?
Okay. I'm on the spot. So the way mesolimbic.
Yes. So I like to divide the pathways in four. That's why I
Okay.
do this with my hand because it's like it's easy for me. Anything that makes sense to you, you can use it. Right. So the mesolimbic. Do you mind? Would you? Okay, go ahead. Tell me what you think. Isn't it totally okay to be wrong? It's better to be wrong here than
Okay.
in another place. So please go ahead. Be wrong. You have the rights to say whatever you want.
I'm still on the spot and
Okay. So you can call a
okay.
friend. Pick a friend. Who would like to help her out? Gina? Gina?
Yes,
Okay.
sir.
Okay. Go ahead. Help her out.
Okay. The Mesolimbic is the dopamine, and if it's
Okay.
high,
Okay. So it's high dopamine mesolimbic. What
and then
happens there?
positive
What?
symptoms of
Okay.
hallucination,
All right.
delusion.
So you are right. Mesolimbic. So the mesocortical, what happens?
Mesocortical is the negative symptom. The dopamine level is low, and one of the signs
Okay.
is hyaldonia.
Of
Think
like
breast move also like that.
apathy.
Yeah.
Okay.
Okay.
All right.
Then
Yeah.
the next one is the VTA. That is
Okay.
where you have the motor or the muscular symptoms where they have it's a low dopamine, increased acetylcholine,
Okay.
and
And
that's
what
where
are
the
okay,
Parkinson
please?
um,
Mm-hmm.
and what else? Parkinson, Partington, and I'm missing one. I know it's three. So
Oh yeah. So all your EPSs, right? So
yeah,
you can put them all together in stem pot, make a soup. All your EPSs are there. Now the
and then
last one,
the last one is the
tubulus
tubal
spendibular. Okay.
That's the prolactin. This is
Okay.
where the prolactin is high, the dopamine is low,
Okay.
and that's where they have the amenorrhea, galactonuria. They have
Galatoria.
the osteoporosis.
Perfect. I want you to stop right there. Write it down, everybody. Osteoporosis.
Mhm.
Okay. Now I want you also going back to the dopamine pathway. If the question asks you either of the pathways, what is the main cause? I want you to go with the dopamine. For example, the not meso, tibulofundibular pathway. So you have the dopamine that's going down, and you have the what's the
Prolactin.
prolactin, right? So
Mhm.
if the question comes and both of them are there, option A, decrease in dopamine, option B, increase the prolactin, you're gonna pick dopamine. Okay. So same thing as the mesocortical.
Could
You
you
have
repeat it?
say it again.
Could you repeat that again,
Yes,
please?
they are known to put actually both of them and ask you, for example, the mesocortical pathway. Which of the following is responsible for the negative sync? Is it the decrease in serotonin or is it the decrease in dopamine? Right.
Decrease in dopamine.
So
Dopamine.
they both are related. In fact, there are both of them,
But
right?
serotonin has to do with the sleep, the mood, and this.
Yeah.
Right.
So, but that's also responsible for the negative symptoms, right? So they are actually both related. But when it comes to the dopamine pathway, we're talking about dopamine here. So
Okay.
let's.
Oh,
So
okay.
that's why we kind of like wanted to understand, because they might ask you, "Hey, is this because of increase of acetylcholine, or is it because of decrease of the dopamine?" Okay.
Kò
So
lè jẹ pancake.
sorry, I gotta mute
But
you here.
oúnjẹ tó
And
ń jẹ tó ń jẹ lọ́sàn-án ìwọ̀n ò jẹ́ tán.
all right, apologize for that. So let's go ahead and go on to the next question. So let's say, what else can I ask you?
Quiz, I have a question.
Please go ahead.
So I see for the dopamine pathway, seem like we keep dopamine seem to play a bigger role, because like, for example, for the Mesolympic, there's more of a hyperactivity of the dopamine.
Correct.
And then I would see for the Mesolympic and the mesocortical pathway, it seems
Mhm.
like there's more of a blockage of the dopamine.
So when they say the blockage, it's
Is it
the way of
decrease?
say a decrease.
Okay.
So same meaning but a different terminology, which is very important to clarify, right?
Okay.
Okay.
Could
So
you,
go ahead. Anybody got a question on subject?
could you mention the two other parts of the four pathways, please?
Okay. So you have the mesolimbic, which is the cause. One of the cause. We also have glutamate, but mainly important for you is the increase of dopamine. Okay. So what we give antipsychotics, which are D2 blockers, right? Which, by the way, you need to know the difference between first generation, second generation. So it blocks the dopamine, the patient gets better. But because if if you go to my psychopharmacology course, I break this down in a way that you will always understand. Like I call the paddles, because here you have a decrease, but when you have a D2 blocker, it also decreases serotonin. Okay, so here on the mesolimbic, you give a D2 blocker, so it kind of pulls down the dopamine and they reduce the hallucination, the positive symptoms. But it also does the same thing on the mesocortical pathway. So therefore, you have more symptoms like anhedonia, don't want to do things, you feel more depressed. So it contributes to the negative symptoms. Now, uh, the nigrostriatal pathway, right? Some people call it the VTA, nigrostriatal pathway. You have an inverse relationship between a dopamine and what, guys?
Acetylcholine.
Acetylcholine, right? So the question could be, if the movement disorder seen in those patients that are taking antipsychotics are due to decrease in dopamine, or is it an increase in acetylcholine? It's actually both, but we're talking about the dopamine pathway, often someone with schizophrenia. So the answer will be the decrease in dopamine. Now we come to the last path. There are more than four pathways, but usually we cover four. So the last one is the tubulofundibular, right? So there you have an inverse relationship. Again, the dopamine is down, and what is up?
Prolactin.
Prolactin.
So when you hear prolactin, think about breast, right? Not the breast increase that you want, but unwanted breast increase due to the prolactin. Well, increase in prolactin will affect your sex drive. Increase of prolactin will affect the immuno hair, okay? And will also weaken the bones. Out of this, I want to highlight osteoporosis that are known to be on a test, okay? And pay attention. You cannot kind of know, because on a test, there'll come a correct statement and a incorrect statement in the same sentence. Again, for the sentence to be entirely correct, the whole thing needs to be correct. And they'll mix the hell out of everything in it. Okay. So you really need to know. All right, let's move on. We talked about Latuda, Geodon. You need calories with that. Um, we talked about earlier about DBT, Marshall Lynham, who created the main function of DBT is to decrease suicidality, right? So, um, let's say, let me think. If a child is on foster home and doesn't really feel loved and doesn't connect with others, what diagnosis most likely I'm referring to?
Adjustment disorder.
Reactive.
Yeah.
Reactive detachment.
Yeah, I like how you're saying, but this one specifically is reactive attachment disorder. So, but I like where you're going because it makes sense, doesn't it? But in this case, it's specifically for reactive detachment disorder. Hold 1 second, please. Guys, give me 5 minutes so I can deliver my daughter downstairs. She's taking a friend trip, so I need 5 minutes. So I do apologize. I'll be right back. Okay.
Okay.
Okay, it's okay.
Okay. Take your time.
We are human.
Guys, meanwhile, talk to you guys, talk to themselves, you guys, and ask each other questions like what things are you confused. Most of your helps can come from your friends, from our WhatsApp group. You guys as a group are very smart. So give me 5 minutes. Let me deliver my daughter outside and I'll be back. I gotta do my daddy's duty here. Okay, I'll be back.
Okay. Who can please clarify the what do you call that again? The oh God, I can't even remember. Oh, sorry, I'm drawing blank. Hold on.
Talking
The
about the dopamine pathway, is that what you're trying to remember?
no, the
No.
when it's two ways. Either the medication causes the whatever causes the medication to pile up in the blood, or it is oh God. I,
You
um,
The inducers and inhibitors.
yes, 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 please.
Beta.
Yeah, yeah. Can someone just go over that, please? Because I'm like every time I think I get it, it's not really. I don't really get it.
okay?
Thank you.
The like from what I remember, I don't have my notes here, but I can also refer to it. When you look at inducers, right? Like it has the D in it, right?
Mhm.
Tells you inducer tells you that I think is decreased serum level. I don't know. Let me
Yes,
get my notes.
Yes, it does. You're right.
Okay,
yes.
so that means that the medication is likely to decrease the serum, meaning like the blood level, yeah, of
The level of the drugs.
of the drug. Then when you have the inhibitor, which has high in it makes the serum level high.
Yes.
So now we like have to like know which drugs are inhibitors and which ones are the inducers. But let me
Uh, Another thing is, I think they said something about the metabolism. Oh my God.
The speed of the metabolic rate.
The
The
metabolism in
inducer.
is high metabolic rate.
Yeah, speed it up. And the other one
Yeah.
slow it down.
Can somebody mute their music or
Oh,
something?
and cigarette,
Oh,
cigarette.
oh Lord.
Gina, I think it's coming from your end.
No, not my end.
Oh, really? Okay.
No, not my end. From what I understand, because it has a high the metabolism is high on inducer, it clears it up very quickly and it reduces the serum level, which is
That's
the
the 450.
yeah. And then on the inhibitors, according to the diagram, the substrates like 2. And then when you go to the right, when the inhibitors takes over, substrate becomes 3 or 5, meaning it increases the level and the metabolism slows down. That's all I understand. Maybe Dr. Lopez will clarify that.
So once we have a list of the medications that are inducers or inhibitors, because that must be known first. So and the way I read it last week, you remember like when someone goes to the hospital getting ready to have a baby, and then I remember that, but at the time I was not in nursing, and the doctor said they were gonna give me what's that medications again that speeds up your um
Pitocin.
Oxytocin or pitocin?
yeah, pitocin,
Yeah.
and so pitocin in itself is an inducer. So it is an inducer, but what it does at the after a little while, your pain gets so increased, and then so I'm like, how is something an inducer? D means to decrease,
Decrease.
but yet it increases the pain and it increases the speed of, I'm like, I don't know what to do with this definition. I'm not getting it. It's like I read it. It's like I don't understand.
I,
If it's
I,
D for decrease,
There's a
but yet
video.
I think the easiest way is when the medication is decreased, let's say tobacco, then you have
mhm,
to, if the level is decreased, then you have to increase the medication while they're on like antipsychotic. But if they said they stop smoking, then you have to go back and decrease the medication because they are not taking, the inducer is no longer there. So the substrate level is back to normal. So you have to decrease the medication on the inducer. On the inhibitors, if let's say the inhibitors takes over, like say clarithromycin, they will the level will go up. At that time, you're going to decrease the medication, or else they're going to go into toxic level. And if the inhibitors is not there, for instance, clarithromycin, then you have is going to go back to like the normal level. According to the book, you have to try to adjust the medications. I don't know.
that part I get. It's just to me what it's supposed to mean. It does the opposite. So that's where it's like if I know something is an inducer, let's say you're taking lithium, okay, and then with lithium, some patient started on antibiotic. So we know then the antibiotic would be uh, an inhibitor.
Mhm.
You have to
Uh,
know the list of the medications,
yes,
inhibitors,
yes.
because six phases that come. You have to
Hmm.
know those medications alphabetically. That way you don't forget with the inducers and the inhibitors. If you get it down, like the main one, like say steroid is an inducer, it's an inhibitor, it causes
Yes,
causes mania, it causes depression. So
yes.
yeah, you have to kind of know, if you don't know those medications as to which one is in the inhibitors, then it will make sense what you're dealing with. That's the only way that I understand it. And sometimes I don't remember, I forgot, you know. But we'll let Dr. Lopez take over.
Okay. Thank you, guys. This is whooping my butt.
How do you guys remember the neurotransmitters? Like which one increases and which one decreases?
The what?
The neurotransmitters.
Oh, the neurotransmitters, like the
Like which one
Dopamine.
increases like in addiction, like we have GABA and
Dopamine.
dopamine, but how do you know which one increases and which one decreases?
I think dopamine for addiction, GABA for
For addiction too.
uh,
Dopamine and GABA. So
GABA.
dope
Mhm.
and GABA.
And
Dope
Yeah,
then
and
but how
GABA.
do you know
Okay.
which one increases and which
and
one?
then
Both of
norepinephrine
them, right?
is
Both of them. So think about this way, right? Anxiolytics, right? So that's GABA, right? If you get it, you'll you relax. GABA is for anxiety, for make you feel relaxed. So that's anything that's good, feels good is addictive. Okay. Anything that feels good and is fast is more addictive. This is why we prefer a long half a life rather than a short half life due to addiction. All right. So very good discussion there. I just want to point out one thing that people often forget. Sometimes you guys are most of you guys are really stuck on inhibitors and inducers. But sometimes the question is not about inhibitors or inducer. The question is about medications that cause mania or depression. So if you look at the medication and the medication is not an inducer or inhibitor, ask yourself, is this part of what we taught you about medication that cause anxiety? Oh, I'm sorry, depression and or mania, right? So the problem could be that that medication, let's say steroid, in this scenario here, could cause mania or depression. So let's pick another medication, whatever. It could be that that medication itself caused a decrease or increase in mania, right? So therefore, you need to adjust your medication. But we'll go back to it because I do have questions related to that. Okay. So let's say that what is the first line medication? Someone has a question there, or was my WhatsApp? I think it was my WhatsApp. All right. What's the first line medication would you choose for someone in pain out of the antidepressant medication? Raise your hand.
symbolic tricyclic.
All right. So I'm getting having some interference. I'm not sure who it is. Okay, sorry. I heard some noise there. So let me clarify that because I also picked up an incorrect answer. I think someone said SSRIs. So you want to pick a SNRI. Okay. Oftentimes they'll come with if it comes with the question the SNRI and the TCA, pick SNRI. Okay. So for example, for for fibromyalgia, right? So Zimbal, Effexor, Elavil, there'll be TCA, right? So SNRI, Zimbal, and Effexor, Elavil, uh, Palomar, Lyrica, which is a another class of medication, pregabalin, right? Or gabapentin, which is voltage sensitive medication. Let's say you could also give it tramadol, but we are going down in the rabbit hole here. Okay, so and by the way, tramadol is actually a medication that you should write it down because it could potentiate serotonin syndrome. Okay, if given with serotonin medication, especially in real life. Okay, so let's say now somebody that does not understand this. I know most of you guys do. So I want somebody that does not understand this answering me this question. A patient has been stabilized on Zyprexa or Ozempic and is also a long time smoker. So the patient smokes all the time. He is involved. No, now he comes to you says, I want to stop smoking. I've been on a smoking cessation program, right? How will you adjust his medication after he stops smoking? So somebody there, give me the rationale. raise your hand. I cannot see all. So if you did raise your hand, please let me know. Okay. Anyone could give me a rationale there? Would you increase, decrease, leave it the same, or decrease, right?
Decrease. On
Dec-
decreases medication because
Okay.
the serum level is kind of
Mhm.
back to normal.
Okay. So,
Initially, you increase it, so now you have to decrease it.
okay. Very good. Now, if someone has a binge eating disorder, what kind of medication you could what kind of class of medication you could potentially give for someone with binge eating disorder? All right. We have,
SSRI? Oh, sorry.
say again?
Is it SSRIs?
No. Well, you know, mm, it's not that's not correct. It is actually correct. You couldn't give an SSRI, but I'm looking for something for medication that decrease the appetite.
Wellbutrin.
Oh,
On
Mm.
Wellbutrin.
Okay, so I want to stop there and actually make
No,
a strong point. You do not give Wellbutrin
we're not
or
giving.
eating disorder. So since we're
No.
talking about Wellbutrin, give me another condition in which you do not give Wellbutrin.
seizures and
Seizures.
TBI.
Seizure or eating disorders,
TBI.
TBI. Okay, so be careful with that. Okay, so I'm referring to Vyvanse, a stimulant will decrease binge eating. It could potentially decrease binge eating. Okay, so who creates the nurse codes of ethics? Raise your hand, please. Codes of ethics. Which organization creates the code of ethics?
The boards of nursing?
And
No, that probably would be on one of your answers, but that would be incorrect.
American Nurses Association.
Yes. Perfect.
DNA?
and yeah.
Okay.
And
So I guarantee you. Well, I can guarantee because I don't know this, but if I was making the test, I would put the state board of nurses the A. Okay. So is the A and A? You need to know this. Um. So if
Wait, what was the answer? I'm sorry.
A
American Nurses Association.
A and
and
A. Yes.
Annie.
Okay. If a nurse comes, not a nurse, a patient comes to the ED and is anorexic and has severe labs abnormalities. So your action here is to collaborate with the ED doctor. Okay. Anytime you have an answer that says collaboration, it's very likely to be the answer. Okay. Because they like to see you collaborate as a team. Remember, alone we are nothing. Together we are very strong, and and that's a true fact. Okay, which of the Theodore phases is more like I call it masturbation, but it's like self-discovery. It's a young boy of 3 to 6
Phallic.
years, phallic stage. Okay, is that normal or abnormal?
normal.
No.
Three to
Okay,
6 years.
all right. So okay, all right. So that's normal, right? So make sure we get that. This is an easy one. ACE inhibitors, right? It could cause lithium toxicity if taken together. But what is the main condition in which ACE inhibitors could be given to or useful other than hypertension? Okay. Okay. Other than that, I'm looking something specifically.
Heart failure.
Heart failure. All right. Write this down. All right. Um, if you have a patient and you come in the inpatient ward and you have a patient that is agitated and the nurse stops that, well, he's been a little bit violent, and you come to assess the patient, would you assess this patient on option A? Actually, this one I want to hear everyone's input, so use the drop box to write it down your letter. Okay, so the drop box on the right lower corner. Your option is it's been a bit weird, right? Violent or maybe agitated. A, do your assessment with others to ensure safety. B, do the assessment with the door semi open. C, have the patient bring one of his friends to ensure mutual safety. Or D, defer the assessment to 48 hours later. What would you pick? B, right? So you want to ensure when we say patient safety, it doesn't mean only the patient, right? In fact, it should be safety, right? Just safety should be the correct answer there. To it's your safety and the patient safety, okay? So all right. So now let's see another question that I have for you guys. So, like I said, the patient has the right to confidentiality, but not privacy in this case specifically. Okay?
So what's the answer?
Do the assessment on a semi open door where it's easy for you to escape or the patient if it needs to. Okay. So you're not going to say, oh, the patient agitated. I'm not going to see the patient 48 hours later, right? Or you're not going to do the assessment in a break room full with everybody else there. Okay. Now, Lewy body, the patients having what's the main characteristics of patients with Lewy body?
Or hallucination.
Visual hallucination. Okay, so the patient has a visual hallucination. Which antipsychotics would you prescribe?
Atypical.
No,
Sure.
typical.
Atypical. The question is it's a leading question, right? So I'm leading you to the wrong pathway. Would you prescribe a antipsychotic for someone who is having hallucinations? So the answer is yes. Would you prescribe antipsychotics to someone that is supposed to have a hallucination because of disorder? So the answer is no.
No.
If you prescribe a antipsychotics for someone that's having hallucination with Lewy body, you will make things worse. Okay? So it's important because the question sometimes on a board will be misleading, hoping that you go down in the rabbit hole. Okay? All right. So it's very important that you really know Erickson stages, and the Erickson stage is also important. One way you can do this is by memorizing the age. Okay, I'm not gonna go through that because that's a lot. Let's say I also mentioned someone is on a Prozac switching to MAOI. You need to wait 5 to 6 weeks. MAOIs to any other antidepressant, you need to wait 2 weeks. In real life, do we do that? Never seen it. Okay. But remember, this is a test. Everything is perfect, no constraints. So yeah, that's all I have. So let's say all right, let me unmute you here there. Okay. What is the ACT model and who is it used for?
Schizophrenia patient that needs
Okay.
community care.
Okay. What's the number one reason why you would use the ACT model? What's the main goal?
When they are not compliant with medications.
Sure, that's true, but the main goal from the providers of ACT is to keep the patients out of the hospital. Okay.
Yes.
So very good. Alrighty. Uh, so I had a question yesterday that I put in our WhatsApp group that was a bit confusing. Let's say that let me look for the question. Well, let me go by head. So if there is an order set for 2,000 calories for the patient, and you have noticed that the patients are eating 3,000 calories, which of the following should you address? Right? Should option A, talk to the dietitian to figure out what's wrong. B, talking to the nurse manager and explain the importance of using 2,000 calories. Option C, talking to the nursing staff. Or option D, let him have his food to make him happy. A, B,
B. B.
A.
B.
Ooh,
B.
ooh, I like
Talk,
it. So,
talk to the unit manager.
B.
Talk
yes.
to talk to the manager.
Okay. Ooh, sorry. All right. So B is the answer, which was talking to the nursing manager, right? So the fault is not the dietitian's fault. Okay. The order has been set for 2,000 calories. So the problem is the unit. Okay. Now, if the question said the order's been set for 2,000 calories and the dietitian system sending 2,500, then it would be talk to the dietitian, right? So the
Yeah.
order is not the orders that you put in the order, but the nursing staff are not following through the order with the order. Okay. All right, guys. I would love to stay here with you guys all night long, but I think this is enough. I love studying with you guys. I'll put the recordings for today's event. You can watch it. I'll put another 5 hours of the recordings that I did a one-to-one with my other folks yesterday and the day before. So you could easily watch it, make good comments, make good cards, uh, and then bring it to our WhatsApp group if you don't understand something. If it is something that's really bothering you, we can set something up. But mostly, as I'm meeting with people, I'm recording so that way you guys all can benefit. And it'll be under the Kahoot module and upload them today. Alrighty. I will stay with anyone that has a question about the course or intrigued or wants to know anything else, but there will be no more teaching uh for the day. You guys can stay together and talk to each other. That's totally okay with me. You don't have to go. I just gotta go because it's been a long night for me. My wife had surgery and I basically didn't get much sleep. So but before I go, just want to answer a seashell question.
Yeah, Dr. Lopez,
Yes.
I, I just wanted to know when I'm doing the 30-day
Yes.
30-day trial, right?
Yes.
There is the first preparatory test. Do I have to do that test first before going through all the modules to see where I stand, or do the modules first and then do the test?
Now do the test first, right? It's very good because the average really is 53. So if you were scoring like a 60 or 65, you were actually very close to doing well. Okay. And the reason why you wanted to do that is twofold: is to let you know where you are. Two is to see how you progress because you will be taking the same test on module 7, right? So module 7 take the same test, module 8 you take a different test. They all very related to each other. And if you score 80, I can almost guarantee you that you will pass your board. My test is probably harder than the board, so you shouldn't be scared of take it. Doesn't matter if your score is 20 or is 100, right? Well, it sort of does. It does, but you need to know where you stand, right? So don't be afraid of taking it.
Yeah, my problem is that, if I, because I'm just doing it not with the intention of doing it for the board, because I'm still in school. So,
Okay.
so when I start doing it, if I'm interrupted, then when I come
Yes.
back to do it, I go back to question
No,
one.
yeah. And the other reason is that many people, not many people, but few people we're not able to answer 175 questions in 3.5 hours, right? Because we are used to, oh, let me answer 5 questions or 10 questions and go take a walk. 175 questions is a marathon. It's not a quick race. So you have to have the stamina and the focus, because throughout the day, our focus will decrease. And by the way, if you have an option to schedule your test in the morning or afternoon, always schedule in the morning. Scientifically, that's the best time, maybe 9 o'clock after breakfast. So anyway, so since you are not really studying for the board, you are getting yourself warm up with the case. You can do later. It's not like a must. It's not a must. But for those that are studying, that have a deadline, 20 days, 40 days, 60 days, I definitely advise you to do it as you are sitting down, because it gets real when you get a date. It really gets real. It gets real very quick. Okay. Sherry, you have a question
Thank
there?
you.
Absolute, my pleasure.
Um, Hi, I
Hi.
downloaded the Kahoot. So when I log into it, how do I find your information?
So when you log in into it, I'm going to give you a code, right? Once I give you a code, it'll prompt you to create a username or your name, and then you are in, and then basically logs you in. So what logs you in is my code that I give once I log in. So
Okay, gotcha.
all right.
Thank
Tenny,
you.
my
Okay,
pleasure. Uh Sorry, there is some interference here. Go ahead.
I have a question for
Hold on a second, please. Is it only me that's hearing this interference, or is somebody else?
Everyone.
I'm
Everyone.
hearing it.
Okay. All right. So if you are not talking, please mute your mic. Okay. So please go ahead. Oh, it's
Please.
you. Let's see. Let me mute myself.
She might have had two devices together.
Well,
Probably.
we can't hear.
All right.
She's
So
not here.
I think it's you that are causing this interference. If you do have a question, maybe you have two devices together. You might want to unlog from one. Maybe you have your phone and your computer, or because that noise is a bit distracting. But if you do have an important question, please go ahead.
Okay, can I ask more?
Yes,
Okay,
please.
okay, Dr. Lopez, I need is a problem.
That's a lot of noise.
Okay, better. Okay, the doctor is wrong. I don't know where this is coming from.
Type your question, please.
Yes, go ahead, please.
It's gone now. Okay. I need it. Can I get I haven't been able to get to the question bank, so I need the code.
Okay, please send me an email, PMHNP at mpexamcoach.com. I'm going to write it down in a chat box, and I'll make sure that I'll get it to you today.
So can I get the email address again? Because the one I sent before didn't answer.
Yes, put it in a chat box, please. Would you mind that? To make
I
sure that
can
I get it.
message you.
Yes, you send me a message, WhatsApp. You guys all got my number. As you can see, I'm very personal. I don't exclude myself. I'm always on, especially in the WhatsApp. Yeah, send me on a WhatsApp, and then I'll go ahead and get it, and I'll do it right away. Okay. All right.
I'm sending it.
Okay, no problem, man. Thank you. What other questions do I have that I can help your learning process or help you out in any ways? I'm going to mute you because this noise, but I do apologize about that. All right. Not sure. Gina, you might have to. Oh, not Gina. I can't say. I don't know if that's Jocelyn. You have to mute yourself there, though. All right. So, what are the questions specifically about the course that you would like to know, or you're still confused, or I could do something better for you? Okay. All right. No worries. Tini, do you have a question?
Yes, Dr. Lopez, thank
Please go
you.
ahead. Absolutely.
Yeah, so I just wanted to know about the Kahoots. Like, I'm not able
Okay.
to be here every Saturday, and I
Yes.
was wondering if you post every single episodes or you just choose some of them and post, and where do you post them?
Yes. So I'm supposed to post every single episode, but sometimes I don't. But I do have all episodes. If you missed one, let me know. I can go ahead and post it. Um, what usually happens is I post it to module 9 on our um courses. Remember that unfortunately, when my website went down, I had to burn the midnight oil and create the entire post into a different website. So now I have two websites that can cause confusion, but one that says XP is the one that I use the most and update the most. Okay, so I usually is module 9 on XP. Okay,
Okay.
the XP is
Right.
the
So
one that
it's
you have the magic link. You just click and you in.
all right. So it's basically under the 30-day program.
Yes. It is.
Okay.
Everything is under the 30 days program. Yes. It's very inclusive. You get everything, Yes.
Okay.
It'll be a
Thank
module
you.
9. Use the one that has a magic link. Okay. So the magic link is just another way of saying your password, but it kind of records which computer you're using it and automatically log you in. Also, if you'd like to download the app, you can download the app and watch the lectures on a go. Do not count that as a study. You can watch it for your own benefit or entertainment, but do not count that as a study. Study needs to be focused. Study needs to be with a pen. You need to be writing down, help your right hemispheres, help your right parietal to get that information and learn it, memorize it. Okay. All right. Is anyone here that would like some information about the course, or you already know all you need to know? Otherwise, I think this is we come to an end. Today it was a pleasure. I was a bit distracted today because I woke up super early, like 4 in the morning. So my 5 in the morning, I was online and I was by myself. I was like, "What's going on?" So I was an hour early today. So I'm glad to see that you guys all showed up today. Next week, I'm gonna make it a super focus for the board answers and the questions. So do not miss next week. It'll be very much a test, kind of like learning the process there. So make sure that you come next week as well. Okay. Other than that,
I'm
go
happy
ahead.
to next week.
I'll make sure I'll record and I'll make sure I'll update to the XP content there. Okay?
Okay, thank you.
Absolutely.
Thank
So
Thank you, Dr. Lopez,
my
and I wish
pleasure.
your wife a
I
speedy
know.
recovery.
I know I
Now.
took a week off, but it's like more this whole week than I ever did in my entire life. But she's doing all well. Thanks for your
Okay.
good wishes there. All
All
right,
right.
guys. Have a blessed night.
Bye,
Take care,
everyone.
everyone.
Bye
Thank you,
bye.
Thank
Bye
you.
bye.
Our regards to her.
All right. Thanks. Appreciate it.
Sure.
Bye bye.
Bye.
you can talk with people?
I think the class is completed already.
What are people still, Emma?
Some people are there.
Can anyone hear us? Emma,
Yes, they can hear us. So I'm going to mute ourselves. Yes. See? Now whatever we talk, they can hear. So this is the way of doing the Kahoot. So now we have is this button, we can answer it.